Welcome to Brain Wellness, the podcast. I'm your host, Mandi NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. Today, I am picking up with another of the ABCs of concussion episodes with the letter B. Before we get into today's episode, I have a few little housekeeping things that I want to make you aware of. First off, I haven't made this announcement in a while, but if you do like what you hear on the show, there is a way that you can support me and you can buy me a coffee. The link is in the show notes to buymeacoffee.com. You can support the show in any amount possible by buying me a virtual coffee. I do all the work on the show, from finding the podcast interviews to doing all the editing, the posting, the interviews itself, the everything. So if you like what you hear, please do consider supporting this show by buying me that virtual coffee. Otherwise, other ways you can support me and the show. My book, Welcome Back, a TBI recovery story from provider to patient, is available on both Amazon.com and BarnesandNoble.com, as well as on the Audible app as well. So you can listen to it if you don't want to read it or can't, as in my case. And there's a new feature on the podcast now where you can leave comments. So I invite you to leave comments on the show, whether it's something that you're interested in or something you want to see in future episodes. That feature's always been there on YouTube. So if you're listening on YouTube or watching on YouTube, you can leave those comments there, but you can also do it on Spotify as well. So that is there. I don't know about Apple, but Spotify, you can do that. YouTube, you can do that. I love seeing the comments. And that's kind of a little fun thing in my day. Aside from that, I would ask that if you enjoy what you're hearing on the show, that you please share this with other people. Leave me a review. That actually helps to bump me up in the ranks so that this gets seen by other people, additional people, so that we can get more traffic on this and bump that show up for higher audiences. So I would love to get more people listening to the show and hearing the information that we have to share on here, whether it's the wonderful interviewees that I have come join me, or shows like today when it's just me sharing the wealth of knowledge that I've gained, or things that I've had to look up because I've lost the knowledge and had to relearn it since the accident. So here we go. Today we have the ABCs of concussion, the letter B. So all the topics that we will cover today begin with the letter B, as with the last ABCs where we covered the letter A. Moving on in the alphabet. So the first topic I want to talk about today is behavior changes. And behavior changes may also be known as just a bad attitude or being belligerent. Also things that start with the letter B. It can be things like the agitation and aggression that I talked about in the letter A episode. It can also look like emotional dysregulation. So I have a child with autism, and we see emotional dysregulation with him a lot. That was one of the first things that we saw with his diagnosis, actually. Long before we had the diagnosis was his dysregulation. With dysregulation, what does that mean? We just have sudden mood swings. So you can say, oh yeah, that's any perimenopausal woman, right? No, you add a perimenopausal and a traumatic brain injury, and you get the picture of me. So sudden mood swings, you go from one extreme to another. I always tell people that whatever feeling I have, I am 100% in that emotion, whether it's happiness, sadness, frustration, anger, excitement, whatever it is, I'm in it 100%. And those swings can happen rather quickly. You can see extreme reactions to just everyday activities. So angry outbursts where you wouldn't suspect somebody to have an angry outburst. You wouldn't necessarily expect an angry outburst when, so there's always been the joke, don't cry over spilled milk. Spilled milk can cause an angry outburst in somebody that has behavior changes following a concussion or TBI. Sudden tears where there's just don't need to be tears. This whole last week, I've been kind of an emotional hot mess, and I've been on the verge of tears every day for no reason. And people can ask me a question, and I have to fight back tears. And it's not a question that should make me cry, but I have just those feelings all the time. Some people experience laughter at inappropriate times or tears at inappropriate times too. Sometimes we call this pseudobulbar affect, PBA for short. We see this a lot in stroke patients. I saw this a lot when I was dealing with stroke patients in the hospital. That's this pseudobulbar affect, where people would have this inappropriate times of laughter. And it can happen where it would be very embarrassing. People would have laughter when they were sitting in a funeral, or they would cry at times when they were supposed to be laughing. Um, it happens because the injury affects the brain's emotions. Having these outbursts, at any of these outbursts, can cause embarrassment for the person, and it can cause the person to isolate themselves because they don't want to have those emotions. They fear those emotions happening. They are so embarrassed by them that they want to stay away from other people because they don't want people to see those outbursts. Another thing that I've seen with this is just road rage. Road rage happens way more often than before. I had somebody tell me early on, well, it's probably just part of your PTSD, and that is not the case. I went through therapy for my PTSD. It is not the PTSD, it is the road rage, because the people on the road, it seems like they just don't know how to drive anymore. And yeah, maybe there's a little bit of me being a little bit overly sensitive, but just getting upset when people don't use their blinker, when people are moving when they're not supposed to be moving, when people are going slower than they should be. Basically, it's just getting easily irritated by things that didn't used to irritate me. And I know I am not the only person that has this problem or this issue. Maybe it's not a problem for everybody, but just these behavioral changes, these emotional changes can be very difficult to deal with, because maybe the person dealing with them was not an emotional person to begin with, or maybe they were, and this is just a different kind of emotion than previous. Um, some people with these behavior changes may have different social difficulties that cause them to avoid other people, like we were just talking about, because of the mood swings, but they might just avoid other people in general because they don't know how other people are going to react. They don't know how to read other people. They don't know how to appropriately identify how other people are thinking, feeling, responding, etc., etc. These social behavioral changes can cause the person with the TBI, the concussion, to interrupt others when they shouldn't normally. So trying to have a normal conversation, and more often than not, they're interrupting. We see this a lot with children, but as adults, we shouldn't be doing this anymore. We should know those appropriate times to let people have a conversation and interject at the conversation at appropriate times, rather than jumping in when it's not an appropriate time to jump into that conversation. But once you have that dysregulation, that change in your filter, as I call it, you might not have the filter to let you know that you shouldn't interrupt somebody when they're having a conversation. You need to listen and answer at an appropriate time, or give a response at an appropriate time. But somebody with a brain injury might not know when that appropriate time is. Somebody with a brain injury might say things that are hurtful to others and not realize that they're saying something that's hurtful to somebody else. They might say something that's inappropriate. It can be something that's sexually inappropriate. It can be something that's just inappropriate to the conversation and just doesn't make any sense. Any of that has been shown in the research to be present. But the things that are said that are hurtful may not be noticeable. This is something that has been brought to my attention actually more recently, since my second injury, since my head injury in August, when I hit my head when we were camping. That's when I've had more and more people telling me that I've been saying things that are hurtful, and I don't realize that I'm saying these things that are hurtful, which then comes back on me because I'm an empath. So I feel other people's feelings, but I don't notice that I'm doing it now, which is really hard on me, because then people come to me and they tell me that I've said things that are upsetting to them, and I don't realize that I've said it. And it's very upsetting to me, the person with the TBI, because I don't mean to hurt other people's feelings. So trust me, if you're dealing with somebody that's got a TBI and they're saying something that's hurtful to you, they're not doing it maliciously. They're doing it because they don't recognize it. Now, I'll give you the caveat that if they were that kind of person before the injury, maybe that's just them. But if that's not the kind of person that they were before the injury, they're not doing it now just to be an asshole, for lack of better words. They're not doing it just to be a jerk. They're doing it because they have no control over that part of their brain. They cannot control the part that makes those statements, and they don't realize that they're saying something hurtful. Again, I have my child who has autism. He does this on a regular basis. I have said multiple times that I feel like I am on the same level as my child with autism now because I do a lot of the same things that he does, and I don't realize that I'm doing them. So I'm forced to do a lot of apologizing that I didn't do, that I didn't have to do before because I wasn't doing these kind of things. So very, very common things. I know I'm not alone in this. It's all over the internet. You can find it anywhere. Um, Research articles talking about it here and there from different colleges, different research studies talking about how all these different behavior changes can be seen, and how it's very difficult to try to deal with it. Yes, you can work with some different therapists, psychotherapists can try to help, but it's a physiological change in the brain that sometimes it's just a matter of time, and sometimes it's the new norm. I will just leave that there. Uh, with concussions, with TBIs, sometimes we see personality changes as part of these behavior changes. And that can, again, be because of different trauma to different parts of the brain. We talked about this a little bit in that A episode also. The more damage to the frontal lobe of the brain, the more issues we have with personality changes. So some of those personality changes, people can have a change in their motivation. We've talked about motivation a lot on this podcast because we talk about brain health and wellness topics. Motivation and mindfulness is one of them. So changes in motivation, so lack of motivation, not being able to get up and move, not being able to get up and do the things that you need to do. Sometimes people become self-centered, not related to the motivation, but just become self-centered. And they very much world revolves around them. Not so much because they mean to, again, but because they have difficulty seeing outside of their limited scope of what they have to deal with right now. They might just be less aware of the needs of the others because they're so focused on the needs of their own self right now, all the appointments they have to go to, all the things that they need, that they might be less aware of those needs of others. I can say that is something that I have not felt like I experienced. My family hasn't told me that, because I am still overly aware of what my family needs, and I still feel like I need to attend to all of theirs. So thankfully, that's not something that I've personally felt, but I know that is something that people can deal with. Again, as I go through some of these symptoms, I'm describing some of the things that can happen to say that these might be things that if you experience them after a traumatic brain injury, after a head injury, that it's not out of the norm for you to experience them. But I'm also explaining some of these things to explain that if you have some of these symptoms and you don't know why you've had them, maybe take a look back and see, did I have a head injury at some point that might explain this? And why I say that is because not everybody knows that they have a head injury at the time of the injury. You don't, as I've said before in different episodes, you don't have to actually hit your head to have a concussion. You can hit your chest. You can have just the force, the sheer speed of the injury cause a concussion. And you don't actually have to hit your head to do it. So you might not notice that you actually had a head injury because you didn't hit your head. And sometimes the symptoms show up immediately. Sometimes it takes days, weeks, months for the symptoms to show up. So it might not be an immediate thing. You might have weeks go by after you had an accident while you were water skiing, for example. You fell and you had a really hard fall on the water. You wouldn't normally think of that as causing a concussion, but when you hit the water that hard, it causes a pressure change inside of your head. That can cause a concussion. You might not notice those symptoms for a little bit of time afterwards. Maybe, so we're coming into winter season, people are going to start going skiing. If you have a really hard fall on the ski hill, yes, that snow can be powdery and fluffy and protect you. But if you fall and hit your head on that, or if you fall and you ran into a tree, or you had some other kind of jarring motion, you can still get a concussion with that. Maybe you didn't feel the effects of it right away, but maybe a day or two later, maybe when you get back to wherever you came from to go to that ski trip, now all of a sudden you start feeling kind of lethargic, not feeling great, a little headachy, a little off balance, and you're not quite sure why. Maybe you're noticing a little behavior change at that point. You're not sure why. Maybe it was related to that fall and you just didn't realize it. So as I go through this whole alphabet, that's what I want you to think about is, did I have something in my past that may have caused this, that maybe I need to get some follow-up attention to this? And I want to bring these attention because so many people go without getting the medical attention that they need, and they're not getting better, and they have chronic issues that develop because they didn't get their problems addressed. So that's my public service announcement. And this is why I'm doing the ABCs of concussion. This is why I have such a passion for educating on all of these topics now, because maybe you're that person that has the concussion or the TBI, and you just want to know if your symptoms are normal. Or maybe you're the person that has these symptoms and you don't know what they're caused by. Either one, I want you to know that there could be a reason for it. And with some of these, I'll try to give you ideas of what you can do and how you can overcome some of these things. In the meantime, if you have other things that come up that you want to ask me about, again, send a comment, send a message. You can connect with me through my website as well. Send me a message that way, and I will try to incorporate your questions into this if I can't directly answer your question to you. So that said, let's move on to the next topic, which is balance. This is something I also experienced big time, and I didn't realize it right away. So balance problems can show up after a concussion for a variety of reasons. It can be because of inappropriate sensory input, again, for a variety of reasons. It can be from physical injuries that were received during the injury that caused the concussion, whether it was a fracture, a neuropathy from some sort of injury, a spinal injury that was experienced during the time of the head injury as well. All of those can lead to balance disturbance as well. Medication side effects. After a concussion, there are so many different prescription medications that we can be put on, whether it's to treat headaches or other pain medications, if it's medications to treat autonomic dysfunction or antidepressants. Any of these can alter your stability, have the potential to cause balance disruption. If you have any vision issues, that can cause balance issues. And some people say, how is that even related? Well, if you have vision problems, that can alter your ability to visually sense where you are. So you can lose your footing and cause falls or disruption in your balance because of that. It can affect your peripheral vision, meaning you can't see what's around you, and that can make you off balance. Your proprioception can be affected. Proprioception is your ability to sense where you are in space. That's a sensory type of thing. But if your proprioception is off, you can't look around and know exactly where you are in representation to something else. So I liken that to as I try to parallel park a car. I can't tell where I am in relationship to the other cars all the time. So I'm not great at parallel parking my car, especially if I don't have my cameras working. So if there's snow on my cameras or whatever, I really can't parallel park my car very well. So in this sense, I have lost my proprioception inside my car because I don't have that sense of where I am in space. So that visual difficulty, I can't tell where I am to park that car. That also can cause problems with balance if you can't tell where you are and you're walking. If that proprioception is off, you can't tell where you've placed your feet. You can have a misstep and you can have a fall. If you have inner ear problems, that can lead to balance problems. That's most likely related to vertigo, which we're actually going to cover way down in the alphabet in the V letter when we get down to that long time from now since we're just in B right now. But that is a huge topic in itself that we will talk about later on. So that definitely is not a problem that can cause balance issues. What do we do about balance issues? That's where we absolutely need to get physical therapy involved. So if you haven't gotten involved with a physical therapist at this point yet and you have these issues, you need to. It doesn't matter when your concussion happened, physical therapy will help you as long as you can get in with them. If they can do an assessment and start working with you on different things, give you some exercises to work on, you can still improve from these symptoms. There's some erroneous information that we give people about recovering from concussion. And for the longest time, we've always told people, whether it's stroke or concussion or whatever kind of head injury that you have, acquired head injury, if you get to that 1 year mark, that's always kind of been the magical number. If you get to that 1 year mark, anything that you get back at that point, that's it. And that's so not true. You can get so much more back after that 1 year mark. If you haven't even started therapy until the 1 year mark, no, you haven't gotten back everything that you're going to get back. Once you start that therapy, that's when you're going to start improving. That said, if you've been having this now develop into a chronic issue, just physical therapy might not be the answer for you. You might need that, quote, outside the box thinking, just the bigger box thinking that we need to look at with things like photobiomodulation, transcranial laser, the things that helped me get better, that I got 6 months into my therapy rather than just the PTOT that I was doing for the first 6 months, because I was really stuck and not getting a whole lot better. It's not to say that the PTOT was not helpful. It just, I needed those other things to really kind of give me the boost that I needed to do. And then I was able to get better because my brain was starting to improve and I could actually see the improvements with the exercises that I was doing with PT and OT then. So none of these therapies that we do are one size fits all program. You often have to layer things and do more than one thing at a time so that they can work on different angles to help your brain heal. But there are things that can help you get better regardless of when your injury was, especially if you haven't had any treatment for it. Then yes, you're not going to be stuck where you are right now. The next B topic is babies and concussions. So babies and concussions, toddlers and concussions, yes, that's a T, but whatever. Babies and toddlers kind of go into the same category. When somebody has a baby who has a concern for concussion, it looks very different. And we can't really treat it the same. We can't identify it the same because babies can't speak and tell everybody what their problems are. So I want to kind of break this down a little bit. Causes, prevention, kind of what it looks like, what do we do with it? Causes of concussion in babies, what can happen? If you've ever had a baby and they've slipped out of your hands, it happens. Is every fall going to cause a concussion in a baby? No. We always say that kids are made of rubber, right? They fall and they're not going to get a concussion with every fall. That said, the falls that tend to lead to concussions in babies are a fall from more than 3 feet, a fall to a hard surface, and a fall with a fast speed. So those three types of falls are more likely to cause a concussion in a baby. Big thing is prevention. Most of these falls can be prevented. The big ones are baby proofing. So baby proofing your home, making sure that it's not going to be easy for a baby to fall in a situation. If you have stairs in your home, blocking off the stairs using baby gates so that they can't fall in those long distances down a set of stairs, for example. Avoiding risky situations. Don't hold a baby in a funky way as you're going down the stairs. Don't try to hold a baby in a basket of laundry as you're going down the stairs. Not a great idea. Hold the baby, bring them down, put them in a safe space, then bring the laundry down. Do the things safely. Use a baby Bjorn, or whatever they call it now. But avoid risky situations so that you don't have to risk having your baby have a fall. Always supervise play. So regardless of the age of the baby, don't leave them in a place where they could potentially fall and walk away from them. If you might have to answer the phone, all of our phones are cordless now. Bring a phone with you so that you don't have to potentially go get the phone somewhere else. But pay attention to your baby too. Always use helmets and protective gear when you are playing. So if you're going for a bike ride and you have a baby with you, use protective gear for the bike ride. Yada yada. We know the things to do. We just need to do them. Use the appropriate car seat for the baby, the appropriate size, the appropriate facing the appropriate direction. Make sure it's working. Make sure it's clicked into the car appropriately. All those things. Prevention is key with anything that we can do with any kind of injury, any kind of health issue. Prevention is always the best kind of medicine, right? Um, Babies, if they do have a head injury, the tricky part is that they can't tell us what they're feeling. So they can't tell us they have a headache. They can't tell us that their vision is off. They can't tell us that they're feeling kind of yucky, that they feel like they're going to throw up. So it's really important for the adults, the parents, to monitor the symptoms and keep a close eye on that baby and watch for any changes. Children often don't lose consciousness. So that's not going to be the typical thing that we see with them. Most babies will immediately cry if they fall. It's a scary thing for them, but their symptoms might not be present for several hours. So that might not be something that you see right away. So you're going to need to keep an eye on them for a longer period of time. Watch for things like behavior changes, emotional, physical changes, or sleep changes. That could look like they have lost interest in the toys, or they don't really want to play. They may be throwing up, or they might be refusing to nurse or eat or drink. They might be difficult to console or calm down when they're crying. They might be off balance if they are walking yet, or they might be unable to move smoothly from a position that they were able to previously do. So maybe they were able to sit up and now they can't do that very well, or maybe they were able to roll and now they can't do that very well. Seizures can be present in babies. What does that look like? Repetitive motions. So if they're like repeatedly moving an arm and a leg, or their eyes are moving off to one side and they're not looking over to the other side. That's what a seizure could look like if you've never seen one in a baby. If they have blood or clear fluid coming out of their ears, that's obviously a definite warning on that one. If they're having new toileting accidents, so if it's a young toddler who's working on potty training and all of a sudden now they're having accidents where they haven't usually had this many accidents before. If they're having sensitivity to noise and lights, they can't tell you that, but maybe you can notice it when you turn on a lights and they flinch their eyes or they try to turn away from it. If they're old enough to hold their head, they can potentially show you that they're in pain by holding their head. And then if they have any bumps or bruises, significant bumps or bruises in the area where they hit their head, that would be another sign. It used to be that we wanted to keep people awake to make sure that they didn't slip into a coma, but we do now know the importance of sleep, and we don't want you to try to force the baby to stay awake. Do try to keep their same sleep schedule. However, if the baby can't be woken, that's when you need to call 911. It is very important to get seek medical help if you're concerned. If symptoms are worsening, seek medical help. It is something that can be damaging to infants, but at the same time, typically for most infants, in a matter of a few weeks, they're back to their normal selves. Most, just like adults, there are the abnormal responses, and there are the more severe cases as well. But the big thing I wanted to talk about is just how it looks different, because those babies can't tell us what's going on. We really have to be watching, and they look a little bit different. But different things to watch for. And that's kind of the big thing that I wanted to highlight there. The next B letter I wanted to talk about is brain bleed. Lots of different terms that we can talk about with that. Hematoma is another fancy word for a brain bleed. We'll talk about other terms coming up here in just a moment, but brain bleeds themselves can be mild, or they might be severe enough to require surgical intervention. The symptoms of a brain bleed can develop immediately, or they can take weeks or longer to develop. And the symptoms that are specific to the bleed, some of them are, again, similar to a concussion, some might be a little bit different. Headache that often gets worse, vomiting, drowsiness or gradual loss of consciousness, dizziness, confusion, pupils that are a different size, slurred speech, paralysis, the inability to move one side of the body, typically because the blood is pushing on the brain. So it acts kind of like a stroke. Seizures can be seen again because blood is very irritating to the brain. And then the big thing to note with a brain bleed is that really kind of with any kind of concussion symptoms, if symptoms are worsening, you need to call 911. You need to seek medical attention right away. With a brain bleed, it can be life-threatening, depending on the severity, depending on where in the brain the bleed is. That's always the biggest concern. When somebody hits their head, that's why we do imaging first, is to see, is there blood on the brain? If there's not blood on the brain, it's not considered as severe. So when they do the different levels of traumatic brain injury, they level it based on whether there's blood on the brain or not blood on the brain. So somebody can have a severe symptom load of a symptom load with concussion, but they don't have blood on the brain versus somebody that has a tiny little bit of blood on the brain and has very mild symptoms. But that's not how we're terming that, unfortunately. So that's why our labeling system with concussion and TBI is not super accurate. What causes a brain bleed? Falls most often. I live in the Midwest in Minnesota, so we're coming up on winter. We just had our first snowfall. Snow, ice, slippery conditions, that's probably the number one cause of falls, especially for the elderly here in Minnesota. Falling, hitting your head causes a lot of head bleeds. Motor vehicle accidents right up there. Assaults, unfortunately, another common cause of head bleeds. And if somebody is on blood thinners, especially elderly patients, even mild trauma can cause head bleeds, and people might not even remember the trauma because it can be that mild. So other words associated with head bleed, we can use the term subdural hematoma, epidermal hematoma, or intracerebral hematoma or hemorrhage. What do those look like? A subdural hematoma is a bleed that occurs between the brain and the dura. There are several different layers on top of the brain of the protective layers between the brain and the skull. The dura is the outermost layer. So this is between the brain and the dura. It presses on the brain. So when that blood happens, the blood vessel breaks in that space, it presses on the brain, and that's what's causing the symptoms. There's acute, there's a subacute, there's a chronic level. The acute is the most life-threatening. The chronic one is more when it happens if somebody is on blood thinners and they might come in. This might be the person that comes in with a new fall and we find a chronic bleed because it was already there, but they didn't have symptoms really that related to that. So they might not remember ever getting hurt. They might not remember that fall. And yes, blood does look different on that CT based on the age of the blood. So that color scheme will look different depending on the age of the blood on the image. So that's why we get that CT first off, to look to see, is there blood on the brain? And that will help us determine the age of the blood that is seen on the brain as well. But when it's pressing on the brain, that's what's causing the symptoms, and that's why it's looking like a stroke. So what did I used to do all the time? I worked in the hospital and took care of stroke patients. When we have problems that occur on one side of the brain, it causes symptoms on the other side of the body, the contralateral side of the body. So we see the same thing with a bleed. So when it pushes on the brain, that's what causes those symptoms. That's why it looks a little bit different sometimes with a brain bleed versus a concussion. So a brain bleed looks more like a stroke than it does just a concussion. Say just, but not really just, but versus, so that's the subdural hematoma. The epidural hematoma is between the dura and the skull. So the subdural hematoma was between the brain and the dura. The epidural hematoma is between the dura and the skull. So right above that. So that blood can collect and cause a little mass of blood essentially that can press on the brain, but it's not quite as close to the brain. There's all those protective layers. So the symptoms are typically a little less severe than you see with a subdural hematoma. It's usually a little bit more mild, but definitely injury related. The intracerebral hematoma, also known as an intraparenchymal hematoma, intraparenchymal hemorrhage, brain hemorrhage, all those different terms that can be used. That's bleeding actually into the brain itself. We're no longer talking about on top of the brain. This is actually in the brain itself. That can be related to a really severe injury, or it can be related to when somebody has a rupture of an aneurysm or a vascular malformation in the brain. So the bleeding is actually into the brain tissue itself. That definitely looks like a stroke. It's going to cause more of those stroke-like symptoms. So big thing to note is, again, those symptoms that occur. If you have those localizing symptoms, and by localizing, that's what we mean when you have those unilateral symptoms that look like you're having a stroke, absolutely need to seek medical care for that, because it can be life-threatening if that bleed continues to grow. You might need surgical intervention to remove that blood. It doesn't mean they're always going to do surgery to remove it. If it's a small bleed and it's in an area that would be more problematic, that if we try to do surgery on you, it could cause more problems, then we're just going to monitor. Because over time, the body can reabsorb that blood and you can heal, and the symptoms uh, will go away and correct themselves as you heal. It will take time. It's not an overnight process. It's probably a little bit more understanding than when somebody has a concussion without a bleed on the brain, such as what I had. No bleed on the brain. My CT was clear, but I definitely had lasting symptoms. Here we are a year and a half later. So that's kind of the quick and dirty on brain bleeds. I could do so much more than that. I've done longer presentations on brain bleeds in the past. If you have more questions on that, let me know. I'm probably going to throw different parts of that in as we go. But the big thing is watching for those kind of unilateral symptoms, calling 911 or seeking medical attention right away if needed, and just knowing that difference, that it can look a little bit more like a stroke. The next B topic is bruising, and this one's a little bit different. Bruising can be related to bruising on the head, or it can be just bruising in relationship to any injury you have from the injury that gave you the concussion. Bruising on the head particular, when we talk about somebody that had a concussion, again, concussion can happen if you hit your head or not. So you don't have to hit your head to have the concussion. So therefore, you may or may not have bruising on your head. You can have bruising show up even if you don't hit your head, and you may not have bruising show up even if you do. So it's kind of clear as mud on that one. But oftentimes when people hit their head, they'll end up with that big goose egg. It may or may not turn into a bruise. That swelling might just go down on its own and not actually turn into a bruise. But we call that a contusion when we do have a bruise with a lump that you can feel. Bruising can happen even with minor injuries, and it might not be present right away. It might show up later on, especially if it was a deeper bruise. How do you deal with it? You can use a cold compress on it. Depending on the site you look at, it's questionable whether or not they want you to use ibuprofen, especially in those first 24 hours, due to the risk of bleeding, especially for the first 6 hours, or especially for babies. No ibuprofen for that risk of kidney injury to the babies. But acetaminophen, Tylenol is probably fine. But just watch out for potential use of ibuprofen, especially in those first 24 hours, for the risk of making that bruising worse. But questionable on that. But beyond that, cold compress might help with that. And as I mentioned, you might have bruising in other areas of your body depending on how you arrived at that concussion. So if you were in a motor vehicle accident, you might have bruising in other areas of your body. If you were injured in a sports accident or skiing accident, in a fall, whatever, you might have bruising in other areas. Those bruises, depending on how severe, how deep they were, they can take weeks to months for them to actually heal and go away. I ended up with a bruise on one of my knees that took many months to actually go away because it was a very deep bruise. I didn't have any bruising on my head, didn't hit my head, but that bruise on my knee lasted for a very, very long time. So the bruising happens just because of the force of the injury. And again, depending on the depth of the trauma, you will see it show up later at later times. It can last longer as well. Cold compress will help. Just keep an eye on it. And then not last, second to last topic I want to talk about is brain fog. Brain fog is probably the most common symptom reported by people that have a concussion or TBI. What exactly is brain fog? Brain fog can be just defined as difficulty thinking clearly, poor memory, lack of focus, slowed thinking, difficulty learning new information, and just feeling like you're in a haze or thinking slower than normal. And one of the sites that I was reading, it says you feel like you're thinking slower than normal because you are. Imagine that. So, yes, you are actually thinking slower than normal because your brain processes are moving slower. What triggers this brain fog? Really anything that puts demands on your brain. So if you're in a noisy environment, if you're around a lot of people and there's a lot of conversation going on, if you have to try to read or use a computer, use your eyes, if you have a headache or any kind of pain, any of those things can trigger brain fog. If you have a family, if you have to drive, if you have changes in the weather, if you have pets barking, if you have life, that can trigger brain fog. Any of these things, any demands that you have on your brain, life is a demand on your brain. It can trigger brain fog. What can help brain fog? Um, Time is the biggest thing. Most resources will say that time will heal most cases of brain fog. I will tell you, most cases of brain fog don't actually recover over time from the people that I've talked to, either from the people that I've interviewed on this podcast or patients that I've taken care of or people that I've connected with over the years. Most people have some degree of brain fog still. There are lots of things that you can try to do to reduce it, but there's still some degree of brain fog that just kind of lingers. So things that can help it, making sure that you get enough sleep. I talk about this a lot, but make sure that you get enough sleep, really good, uninterrupted sleep. Stay hydrated, drinking plenty of water. I keep my water with me at all times, and I usually do at least one bottle of electrolyte mix in a day as well, because I'm always short on electrolytes. Eating healthy. We've talked about that a lot on the show. What does eating healthy look like? Eat the rainbow, eat lots of different colors, eat real foods as much as possible. Try to stay away from processed things because processed things are going to slow your brain down even more. Take breaks. Take breaks more often than think you need to take them. My occupational therapist is telling me this all the time. Take breaks before you think you need to take them, because if you wait to take them when you feel like you need them, you've waited too long. Take breaks, take breaks, take breaks, schedule breaks, because the more you take them, the more you will be able to continue going on and not have to crash sooner than later. Avoid alcohol. Alcohol will slow down your brain. It will slow down your brain processing. As much as I enjoy having a drink every once in a while, it definitely does slow down my brain when I do. So I don't very often. I would much rather enjoy a nice drink with my friends more often than I do, but it definitely does slow my brain down. Light exercise and then gradually increasing that activity, because that will help with blood flow into your brain as well. Are any of these things going to completely take it away? No. Have I found other things that help? Also, yes. Again, the NanoV bioidentical structured water that I use at the clinic definitely helps. The PEMF definitely helps. Transcranial laser, the photobiomodulation, all of those things help with the brain fog as well. So looking at the bigger toolbox items, not necessarily outside the box, but the bigger toolbox items also help with brain fog also. There's not a lot of prescription medications that I found that are going to help with that. Unfortunately, most of the prescription medications that they will give us for headaches, for autonomic dysfunction, any of those will typically cause brain fog. So you're not going to find it with a prescription medication. You're going to find it with the complementary therapies. That said, the last topic that I want to talk about today in the B letters is burnout. And burnout, when we typically talk about this, and I've talked about burnout on this podcast before. I had someone come on and talk about provider burnout. Burnout is by definition, when I was looking at one of the, I did not write down my reference, apologize. One of the websites that I was looking at for caregiver burnout described it as an ongoing state of feeling overwhelmed, fatigued, and emotionally drained due to consistent stress. So that is the definition of burnout. That said, burnout is typically referred to as in relationship with work. A lot of times in healthcare, we talk about caregiver burnout all the time. But burnout can also be talked about in relationship to family burnout, social situation burnout. All of these can lead to burnout, but it can also happen to in relationship to all of the appointments that somebody has to go to after a concussion. Because of this, I actually have a chapter in my book called The Appointment Marathon. So the appointment marathon, when I talk about that in my book, I talked about some of this. I don't think I even talked about all of that yet because not all of these were included in there. But I did most of these, and then there are some that I didn't do, and then there are some that I don't have on this list because I don't even know about all the appointments that some people go to. But neurology, neurooptometry or neuroophthalmology, physical therapy, occupational therapy, speech, and the PT/OT speech are usually weekly. Any mental health appointments, I had several. I had my regular mental health therapist, I had my EMDR therapist, and I had my couples therapist. So I had 3 different mental health therapists that I was going to at any given time. Neuropsych for testing and follow-up, primary care appointments, neurofeedback, which was usually multiple times and doing the therapies every day. Red light, my photobiomodulation, and transcranial laser treatments, which were 3 times a week. I had 1 or 2 sessions of chiropractic, but most people do many more than that. And then there are several other appointments, but you're doing all of these appointments all the time. You feel like that being a patient is your full-time job, and all you're doing is going to appointments, appointment after appointment after appointment. It is exhausting, to say the least. So that constant state of feeling overwhelmed, fatigued, emotionally drained, you're explaining yourself to people over and over and over again, and you may not be remembering to tell everybody all of the information all of the time because your memory is not working. You're already fatigued because your brain is not working appropriately. You're fatigued because you're not sleeping appropriately because your brain is not working appropriately. You're overwhelmed because you're trying to keep track of all of these appointments. You have to keep your calendar organized. You have to do all of the exercises that are prescribed by all of the therapists. You have to get in regular exercise or try to. And then never mind trying to do regular things like taking care of your family and your home and getting meals made, groceries shopped for, trying to do some sort of hours at work if you're able to do that. All of these things that you're trying to do, that you're constantly fatigued and overwhelmed and struggling. And burnout as a patient is real. It's not just a healthcare provider thing, it is a healthcare patient thing. And it is a hard, hard thing to try to get over. And it takes a toll on you as a person, it takes a toll on your family, it takes a toll on your relationships. And it oftentimes it makes you feel like you are underperforming at everything. So it's a constant struggle with all of that. So burnout as a patient is a super real thing. The struggle is real. So that is my letter B for you guys today for the ABCs of concussion. I hope you guys are enjoying this series. It's really been kind of a breath of fresh air to put it all together to really kind of highlight some of these things. It's been helpful to kind of powwow with some of my TBI warriors, fellow TBI warriors, to come up with some of the letters to make sure that I get a good coverage of all the topics that affect us as we go through this. But again, if you have ideas on other things that you would like me to include in future episodes and future letters of the alphabet, I would be open to those. And thanks again for listening. And I hope you have a good rest of your day. And I will see you guys again next week. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.